Good evening, and how are you? Welcome again to another session of Ask the Doctors. Today's date is 26th of March 2023, and the time is 8 p.m. West African time, 8 p.m. today. And in case you are watching this video and we have ended, I'm sorry, it means that you're watching an already ended live session. But I know that we have people live with me. This program holds every Sunday by 8 p.m. Welcome. And I can see that some people are joining me right now. I'm live on Facebook and I'm live on YouTube. Now, today we are going to be discussing about tuberculosis. I can see some people already in the house. Can you hear me? Good evening, everybody. How are you? Can you hear me? If you can hear me, say yes, I can hear you. Yeah, let's go. My name is Dr. Frederick Unubohai, and I always tell you good life in a sense. I'm privileged to be the host of this program. My co-host would also join me, Dr. Israel, on the program, and I am expecting him tonight. We'll be having a guest join us today. Okay. I'm chatting with my guest. Yes, we'll be having a guest join us on the program to talk about tuberculosis. So tell me, where are you joining me from? Where are you watching? Oh, yeah, everybody, tell me, where are you watching me from? Oh, yeah, tell me, where are you watching? So we'll be having a guest join us on the program this evening. Okay. Yes, we have our guest is already in the house. Okay, Chief, good evening, sir. Can you hear me? I can see you already. Can you hear me? Yeah, you are not live. I'm going to bring you up right now. Are you set? Are you good to go? Okay, good. So, ladies and gentlemen, I can see we have people on YouTube already. Um, Good evening. Yes, on YouTube. Okay. On Facebook, Tina. Yes, I can hear you. And who is here? Nelson. Yes, I can hear you. Okay, very good. Welcome, everybody. So we have our guest already in the house. So let me bring him up tonight. We have Dr. Ogundare Adewale. Uh, Adewale, sorry, I did pronounce him like Weibo. Good evening, sir.
Good evening, and
How
thank
are
you
you
for
doing, sir?
inviting me. I'm good. Thank you.
Welcome. Thank you very much, sir. I understand that your schedule is very tight and you have decided to make our time for us tonight. We are very grateful.
You're welcome.
Okay, we're talking about tuberculosis, ladies and gentlemen. Last week, Friday, was the World TB Day, and we decided that let's get an expert to come talk to us today about tuberculosis. Our guest is Dr. Ogundare Adewale. He's a senior registrar from the Respiratory Unit of the Lagos University Teaching Hospital. And he'll be taking us briefly on what tuberculosis is, what we need to know about TB. If you have any questions on tuberculosis, please get your pen and your paper and jot them down. And when it's time, we'll be taking few of your questions. So, Chief, this evening, for those that don't really know what TB means, because whenever they hear the word TB, that's what they call it outside, tuberculosis, TB. What exactly is tuberculosis, and why should we talk about it tonight?
Okay. So, thank you very much once again for inviting me. I hope I'm audible.
You are loud and clear, very loud and clear.
Okay. All right. So, tuberculosis, simply put, it's an infection. Um, it's a serious one at that, which, if not diagnosed early and treated as required, can be a cause of disability, or it can be as severe as causing death. So it is actually the second leading cause of infectious deaths. So when we have infectious disease that causes death, it's only second to COVID-19, which we just started experiencing in 2020. So it causes more deaths than even acquired immune deficiency virus, HIV, or the acquired immunodeficiency syndrome, or AIDS. So it's been said that by WHO that this infection actually affects about a quarter of the world population. So you can imagine if we have about 6 billion people in the world. That means about 1.5 billion people actually have this infection. But the good thing about it is that it is preventable and it is treatable. So talking more about the burden of this disease, a larger percentage, more than 2/3 of TB infection and disease occurs in what we call low and middle income countries, such as ours. So we are talking about less industrialized, less economically privileged countries, most of which, of course, is in Africa and some parts of Asia, accounts for the 30 high burden countries in the world that houses TB infection and disease. Just 30 countries in the world, mostly 28 of these countries actually are in Africa and in Asia, accounts for more than 2/3 of TB infection and disease in the world. And then you can imagine that Nigeria ranks in the top 8 of these 30 countries that houses the highest burden of TB infection and disease. I would also like to, lastly, I would also like to state that tuberculosis can actually affect any part of the body, from the brain to any part of the body, just name it. The eyes, the heart, the kidneys, the genitourinary tract, all the parts of the body, but it most commonly affects the lungs in the majority of cases, which is what we'll be talking about today.
Thank you very
Thank you.
much, sir. We have our co-host in the house. Dr. Israel is in the house. Dr. Israel, good evening. Welcome. Sir, thank you very much. You spoke about how common it is, affecting a quarter of the world population. If I may go further with regards to a country like Nigeria, how common would you say TB is? You know, everybody is walking around. We feel like everything is fine. Is it that common in our environment?
Okay, so if I would say in 2019, it was said that Nigeria reported an average of 440,000 new infections. We know that epidemiological statistics in this part of the world is usually lacking because the hospital is not the usual point of call for patients who are sick. And then we should also note that there's a distinction between infection and disease. So when I talked about a quarter of the world having the infection, it doesn't mean that a quarter of the world would develop the disease. Only a fraction of these people will go ahead to develop the disease. And most of the time, it is the people who have developed the disease that would present in an hospital where statistics or data can be collected. And then we can have a true figure of what the burden of the disease is. Most of what we know in Africa and even in Nigeria are estimates, not the true value of the disease burden. Thank you.
Thank you very much, sir. Welcome, everybody. Good evening. To those who are just joining us, you are welcome. We're discussing about tuberculosis tonight. We have Dr. Ogundare Adewale, a senior registrar from the Respiratory Unit of Lagos University Teaching Hospital, and he's talking to us about tuberculosis. He said TB is preventable and treatable. If we want to go further, sir, what causes tuberculosis?
Okay, so like I said in my opening statement, that tuberculosis is an infectious disease. So it is actually caused by bacteria. The bacteria as of what we know today, we know at least 8 species of mycobacterium that causes tuberculosis. But the commonest that we have seen in our environment and even world over is Mycobacterium tuberculosis. So it's a bacteria that causes tuberculosis infection. And it's also, I also like to state that for the commonest species that I mentioned, which is the Mycobacterium tuberculosis, humans are the reservoir. So it's not something you get from the environment or anywhere. You get it from human to human transmission. So if someone who has the disease and not infection now, somebody who has begun to manifest the features of the disease, somebody who is sick from Mycobacterium tuberculosis or that has tuberculosis, when they cough, when they sigh, when they talk, when they smile, they actually push a lot of these organisms into the environment. And anybody who has close contact with these people can acquire the infection. And one of three things can happen. The person's soldiers or immune system might be able to contain and deal with the infection and clear it completely. The body of the person, depending on the bacteria itself, depending on the individual, can keep it in check and stop it from multiplying, or the person can go ahead and develop disease immediately. And then we see this in the very young, the elderly, and people who have problems or issues that causes a depression or a lowering of their ability to fight the infection. So we say people who have some forms of immunosuppression.
Dr. Fred, it seems you are mute.
Okay. Okay, right. Can you hear me now? Yes, yes. Okay.
Yeah, you're audible.
I can hear you.
Okay. Dr. Israel, welcome. So I wanted to go
Thank you.
to the area of transmission, and you already talked about it, meaning that it's so. Let me ask on behalf of the people listening to us right now: are we saying that the only way an individual can get tuberculosis is via droplets, coughing, talking, or are there any other means of transmission of tuberculosis?
Okay, so for the other species, so like I talked about, like I said earlier, the commonest organism, humans are the only reservoir. So which is actually the only way from droplet infection that we can acquire this infection. But for the other species of the organism that I talked about, the next one I'd like to talk about is Mycobacterium bovis, which we can get from infected cows. So, which is why if or when we are seeing individuals that we suspect have tuberculosis disease in the hospital, we ask them if they ever ingest unpasteurized milk. That's the reason why we ask. Although the number or the burden of disease that causes is reducing or has reduced over time, Mycobacterium tuberculosis, which humans are the reservoir, that means it's only humans that can spread it from one person to the other, is mainly by droplet infection.
Thank you very much. There's a question in the comment section. I'll go there very soon. If I see your comments. Let's quickly talk about because we are trying to work with time. If an individual has tuberculosis, the common symptom we know, sir, is cough. What about this cough is peculiar to tuberculosis, and what would be the other symptoms of TB that we need to know as individuals?
Okay, thank you. So, like you said, cough is the commonest symptom. So it's not just any cough. We try to ask around this cough when they present to us. So, cough that has lasted 2 weeks or more. So an individual develops cough, lasted 2 weeks or more. Sometimes the individuals would cough up phlegm or sputum. Sometimes they may cough up blood, but not in all cases. So what will make us suspicious of a particular type of cough, one is the duration. How long has this cough lasted? So this cough has lasted 2 weeks or more, particularly in our environment where TB is actually very common. So is this person coughing up blood? That would also point us in that direction as to think about tuberculosis. But like I said, not everybody will cough up blood. Other symptoms of tuberculosis would include weight loss. So the person notice or the relatives notice that the individual has started losing weight and is significant. That's also one of the common symptoms of tuberculosis. Also, the person may sleep at night and then find out that their beddings and their clothing is drenched with sweat. So they are sweating more than everybody else in the house. Not just when everybody else in the house is sweating. Theirs is more. Their night clothes are soaked. Their beddings are soaked with sweat. Called that drenching night sweat. That's also one of the symptoms. Also, we have what we call fatigue or weakness. The person just feels generally weak.
Weak.
And last but not the least, the person can develop body temperature or fever. So these are all features that can point or as symptoms, the common symptoms. That is by no way exhaustive of symptoms that tuberculosis can present with.
Thank you, sir. So for those listening to us, cough 2 weeks or more, and then you're feeling you're having sputum, blood in the cough, you're losing weight. Sir, are there other forms of tuberculosis that could present different from what you just mentioned? Because most times when we mention tuberculosis, the mind of the public goes to cough, respiratory symptoms, weight loss, and the rest. Are there other forms of TB, other symptoms in other parts of the body that we need to also take note of?
Okay, so like I said, it commonly affects the lungs, but in about 20% of cases, we can have TB affecting other organs outside of the lungs. So in children, or the commonest site where you can find TB outside the lung is what we call lymph nodes. Lymph nodes are those tiny, tiny things that swell sometimes in our neck, sometimes in our groin when we have infection or develop a wound. So it could swell most commonly around the neck. So we could have TB involving what we call the lymph nodes. We can have TB involving the covering of the heart, what we call pericarditis. So it depends on which organ it affects in the body. It can affect the kidneys, okay, what we call TB of the kidney. It can affect the intestine. Patients can present with weight loss that I talked about, drenching night sweats. They can have abdominal swelling, which is due to tuberculosis. Patients can have blood in their urine, which may be from tuberculosis, and a host of all others. So it depends on which other organ. And the most serious form of the type of TB that occurs either in conjunction with that of the lungs or as a standalone is when it affects the brain. If not quickly diagnosed and treated, it can actually be very fatal, meaning that it can actually lead to death. So the person can present with non-specific symptoms: headache, neck pain, stiffness, alteration in the level of consciousness of the person, and so all of those things can actually happen.
Dr. Israel, can you hear me? Okay. Thank you very much, sir. Quickly, because of time, let's say someone presented with all these symptoms that you have listed, sir, and he or she um, is worried and thinking, oh, it's just ordinary cough now. I've been coughing and I've been taking cough syrup. Like what we do when our people begin to cough, they go to the pharmacy, they buy the cough syrup, they take. How would we arrive at a diagnosis? What should we know in trying to arrive at a diagnosis of tuberculosis? What are those samples the doctor would take from the patient? Because sometimes people believe that if you have TB, it's just from the brain you get your diagnosis. Are there processes? What are those tests that would need to be carried out to know that this fellow has tuberculosis?
Okay, so the first thing is to present to the hospital where the diagnosis can be made. Like I said, cough is the most common symptom, but not all cough is actually tuberculosis. So, which is why we ask for those other symptoms that we talked about: the weight loss, the drenching eye sweats, the weakness, the fever. And then when they present to us, particularly with TB affecting the lungs, one of the things we want to do is to get a sample of their phlegm. So this sample is sent to the lab, where we can actually get, in some centers, get a diagnosis within 2 hours of submitting the sputum. So there are tests that can be carried out on the phlegm that can tell us. I don't know how to say it without being too technical. Okay. So apart from the sputum test, we would also order for a chest X-ray. Okay, because I said in most cases it affects the lungs. So if the person is presenting with those features, you want to do an X-ray of the chest where you would find some changes that would be suggestive of tuberculosis. I would also like to state that you do not confirm the diagnosis of tuberculosis by doing an X-ray. So it's a combination of the symptoms that the person is presenting with, doing the chest X-ray, and some other tests, but identifying the organism. So, for example, for TB affecting the lungs, you are able to identify the organism in the person's phlegm. For TB affecting the abdomen now, you are able to, there are certain things that we will be able to identify in the water that causes the stomach to swell. So we must find a way to identify the organism to actually confirm that this is tuberculosis, because other things can actually present that way. Thank you.
Thank you very much, sir, for the how to diagnose TB and the symptoms and everything you've been telling us. We know that TB have some complications that can occur when someone comes down with TB. So please, sir, can you tell us some of the complications that can occur from TB?
Okay, so right now, we now look at TB beyond treatment. Okay, so now there is what we refer to as a disease condition that occurs in certain groups of people who have had TB before. So they present with a whole lot of things. A friend of mine would say TB is an unforgiving illness, because in a certain fraction of people, they can go ahead and develop certain changes that can last a lifetime. So some of these things would include destruction of the lung. So sometimes you can have complete destruction of a whole person's lung. Thank God that we have. Okay, so that's one of the complications that can arise from tuberculosis. Sometimes it can cause some changes, okay, in the lungs as well, that would make the person present as if they have to be when they do not. Some of those changes would include what we call bronchiectasis. So the person keeps producing sputum even after they have been treated successfully for TB, but the previous infection has actually caused changes or damage to the lungs. Okay, so in some people, you can have scar tissue formation, just like when you have any wound in any part of the body and it heals by leaving a scar. So you can also have scar tissue occurring within the lungs. So there are so many complications that can arise from TB infection, either during treatment or even several years after treatment of tuberculosis.
Thank you so much, sir. And Dr. Fred, hope you can hear me.
I can hear you loud and clear.
Okay. Thank you so much, sir. This year, 24th March, we celebrated and the theme for World TB Day this year was "Yes, we can end TB." And so, based on the theme, Sir, can you help us? Can you tell us the how to prevent TB? Because I think that's one way to end TB. And after you finish the presentation, how to prevent TB, you can actually also tell us how we can treat TB as well.
Okay. So I think I would like to start with how to treat. So
Okay.
uh, I would first like to state that one of the most important tests for TB is actually free,
Free.
which is the gene expert in some select government hospitals. This test is free. Treatment is also free.
Sir, please
Okay.
help us say that. Please help us say that again.
Yeah. So uh, I would like to be careful when I say one of the most important tests, because patients, when they present, would actually have to do some other tests.
Yes,
Okay.
yes,
But
yes, yes.
one of the singular most important tests to actually identify the organism and detect whether the organism, that is the bacteria, would respond to the usual medication is actually free. Okay. The drugs for tuberculosis treatment are free. Okay. Um, Treatments can last from between 6 months to 2 years, depending um, on the type of TB. So there is what we call drug susceptible TB. So the person acquires the bacteria that is not resistant to medications that are the first go-to for us when it comes to TB infection. So we call those people drug susceptible TB. For those who have the organism that is resistant to those initial drugs, we call them drug resistant TB. And their treatment can vary from between 9 months to 24 months. But in most cases, the commonest ones that we see are those that are drug susceptible, that means that respond to the usual medications. So we use a combination of 4 medications to treat TB. And the reason is because we want to prevent the organism from becoming resistant to the medications. That's the rationale behind it. So you use the 4 drugs initially for a period of 2 months, and then you use 2 out of these 4 drugs for what we call the continuation phase of 4 months, making a total duration of 6 months. This can be extended to 9 or 12 months, depending on the site that it affects in the body. That's for the drug susceptible TB. For those that have drug resistant TB, treatment can vary from 9 months to 24 months. There are certain things that we do, which is also important in monitoring people who are on treatment. So we want to know if the things that they presented with to us, the cough, has resolved or is going away. We want to see if they are gaining weight, because we mentioned weight loss as part of um, what they would present with. They will no longer have night sweats. They will no longer have high body temperature. Yeah. So we monitor them for this duration, for the duration of treatment. And then we also monitor them for complications of the medications. There's actually no medication without side effects. So before individuals start these drugs, we counsel them properly on what the possible side effects are. So, and we also monitor for this during treatment. In terms of TB prevention, um, there are certain strategies that are in place, but the most important one is still identifying patients with or individuals with tuberculosis as early as possible. It is said that sometimes it might, according to the World Health Organization, it can take up to a year before a diagnosis of tuberculosis is made in some cases. And what happens is that these people are in contact with so many other people. They also contact the people they work with, people they board buses with, people they travel in there with. So these other people are exposed to the organism. You know, we talked about it that when these people cough, when they talk, when they laugh, all of this, they release the bacteria into the air, and if the circumstances are favorable, an individual who is in that vicinity can actually develop the infection or not the disease. So it is important to quickly identify those who have the infection and treat appropriately. Okay, and ensure that they adhere to these medications. I know it's not easy completing a 3-day course of anti-malaria, not to talk of taking medications for 6 months to 2 years. So it is important that they are aware of the importance of completing uh, the medications as prescribed. So that's one way of preventing it from spreading to other people. Okay. Um, there is also what we call TB preventive therapy. So these are people who are contacts of people who have TB. You want to treat them so that they don't develop the disease later. So there are certain categories of people when you have children, especially under the age of 5, because the immune system is not yet well developed to handle this infection. People who have HIV who need TB preventive therapy. People who go on certain medications. There are certain medications that depress the immune system. You also want to treat. You also want to screen these people for TB infection and treat accordingly, so that they don't go ahead and develop the disease. Also, importantly, is immunization. Okay, so it's part of the national immunization program. Almost every child that is born, as soon as possible after birth, would receive what we call the Bacille Camelgrain vaccine, or the BCG vaccine. I'm sure some of us, or most of us, would be familiar with this, especially those who have a scar um, following the infection. I also like to state that the vaccine does not completely reduce the risk of developing the disease, but especially in children, reduces the risk of developing a severe form of, uh, of the disease. So these are some of the ways um, in which we can prevent TB.
Thank you, sir. Let's take a few comments. There are some questions here. Let's just take one of them. The first question on our chat says, can tuberculosis affect pregnancy? Same thing with the other
Okay,
one here. It says, can tuberculosis cause miscarriage? And then she says, Ivie says, can tuberculosis affect pregnancy?
okay. So like I said, that tuberculosis can actually affect any part of the body. Tuberculosis can actually be a cause of infertility. Okay, because everywhere in a part of the body where you have TB, you would have you can have what we call tuberculoma, or you can have scar tissue formation. If this occurs within the tubes, the person can actually develop infertility. TB affects, I told you how we acquire the infection most of the time. It's via inhalation of droplets. Okay, so you have to inhale it, and it establish itself within the lungs, and then it spread throughout the body. And that's how it gets to all parts um, of the body. So it depends on what you're asking. It can affect the mother, and if it's severe enough, it can affect the pregnancy. Okay, so that's one of the ways in which TB, can actually um, affect pregnancy. Can it cause miscarriage? Never say never. But like a direct causal effect, I'm not so sure. But if it's severe enough that the mother is sick enough, I think even severe malaria can cause miscarriage. And tuberculosis is a much, much more severe disease. And like I said, it's a disease that can affect any part of the body. So if it's severe enough in the mother, it might be serious enough to cause a miscarriage.
Thank you very much, sir. Sir, with regards to the treatment, at what point during treatment would a patient not spread the disease or spread the bacteria. So let's say somebody is currently now on treatment. How long would this person need to be on medication for us to say that this person can no longer spread the disease to the contacts?
Okay, um, it's a question that does not have a clear-cut answer. And I'm saying that because there have been arguments for and against. So some authorities state that by the time the person has used the medications for at least a minimum of 2 weeks, it doesn't say the person is no longer infectious. It simply states that the person becomes less infectious. That is, the risk of spreading it reduces. Okay, so it doesn't say that the risk is completely removed, but once the person has taken the medications, because we must understand that TB is a disease that causes stigma. Okay, so but once the person has been treated and then the person is cured, the person cannot spread the disease. And then the person becomes less infectious after taking the medications for at least 2 weeks. I would also like to state that TB affecting the lungs is only the one that can be spread via these droplets. If someone has TB affecting the intestine or affecting the bone or affecting the brain or affecting the lymph nodes that I talked about, or affecting even the coverings of the lungs, not within the lung itself, those forms of TB are not infectious, meaning that the person cannot spread it. So it's also important to state that.
Thank you very much, sir. Quickly, I don't know, sir, if you want to throw a little light on the stigmatization and what people should understand about TB stigma and how can we reduce the stigma associated with tuberculosis.
Okay, so I think the most important thing is to educate uh, the public. People fear what they don't understand. If you understand that it's an infectious disease, and then the person probably acquired it from somebody else, we've actually seen there are certain populations that are at risk. So if you have people who live in um, in hostels where there's overcrowding, if one person gets it, almost everybody in that room gets it if the contact is long enough. So it's not the person's fault. It's not as if the person has done anything wrong. The person was just in contact with someone that probably has an established disease, acquires the infection, and that it is curable in most cases if the person is diagnosed and treated with the appropriate medications. And then once the person has completed the medications, I can assure you that they are no longer infectious. So we need to understand that, um, and also put it at the back of their mind that these are people who are suffering from an illness, and what they deserve is our empathy and our support. Thank you.
Thank you very much, sir. If you have questions, okay, there is a question here, but sir, you have taken it before. I don't know. Should I put it up? You spoke about this earlier. Says what really causes tuberculosis and what are the types of TB? You spoke about this at the earlier stage of the discussion. I don't know
Okay,
if
so
you just
I can just go over it again. Like I said, it's caused by bacteria. Mm, what we call the commonest is the Mycobacterium tuberculosis. It's a bacteria, just like we can have any other bacteria infection. The types of tuberculosis. So the commonest type is the one affecting the lungs, which is what we call pulmonary tuberculosis, which occurs in about 80% of cases. And in about 20%, we can have tuberculosis affecting other parts of the body, and sometimes in addition with affectation of the lungs. So we can have what we call TB meningitis, can have what we call TB pericarditis, we can have what we call renal TB, or TB affecting the
Mm.
kidneys. So we can actually have TB affecting any part of the body. I mentioned swelling of what we call lymph nodes the other time as well. So those are the different types. And the important thing about these types is to note that it's only the one that affects the lungs that is contagious. The others that affect solely these other parts of the body are not infectious or contagious. I hope that answers the question.
Thank you very much, sir. I have a question with regards to the treatment. What are those challenges you face, let's say, in the management of patients with tuberculosis? What are the challenges you have seen that hinders treatment of patients with tuberculosis?
Okay, so I think the major problem is late presentation. People don't come early. Not just the problem is not just with tuberculosis. Our
Mm,
health seeking behavior is actually very poor, and one of the reasons is not far fetched. If you live in a country where most people have to pay out of pocket to access healthcare, it's it's very difficult because you can imagine people who can afford 3 square meals coming to the hospital unless the disease is now very, very bad. I'm knowing fully well that these are particularly a subset of people that are most susceptible to tuberculosis because things like malnutrition, overcrowding are risk factors for acquiring the infection. So late presentation. If we don't present early, sometimes the treatment might be challenging uh, or difficult. And then two is when people do not, even when they present, when they do not comply or when they do not adhere to the treatment course. So you tell an individual you're going to take these medications for 6 months, um, and they feel better after a month or two, and then go away, and then the disease comes back, or they come back with a form that is not even responsive to those initial medications. Um, it becomes it becomes a challenge. Um, so those are some of the challenges, and like I also mentioned, so we are beginning to look beyond treatment because we know that a certain fraction of people would develop long-term complications of TB. And one of the reasons why they might develop that is when they present late. So
mm,
they have given the organism or the bacteria enough time to cause a lot of havoc or destruction before presentation. And then it becomes a bit tricky in terms of how you manage these individuals. And like I said, for some of them, management of this condition can now become lifelong. So those are some of the challenges that we encounter from day-to-day management of patients with um, tuberculosis. Also, tracing their contacts, which is also very important because we talked about breaking the cycle from infection to disease. So being able to, so sometimes you tell them, bring your relatives in for screening. Um, so they might have to do some tests that would come at a cost. Um, and if there is challenges with finances, they may not come out. Those people, a certain fraction of them may eventually develop the disease later, which becomes a separate burden in itself.
mm, mm. Thank you very much. If your question is not clear, please send this question again. I can't understand. Doctor, most patient treatments, outpatients, long treatment form. I don't know if, sir, this is clear to you. I don't understand this. comments. Please resend your question. So I want to ask something concerning herbal concussions. I don't know if you have come across any, but on social media, I see this a lot. You hear it can cure this, it can cure that, it can even cure tuberculosis. From a professional standpoint, is there any relationship with herbal concussion managing or curing tuberculosis?
Okay, yeah, if you remember, I said that we don't really know what the burden of the infection or the disease is in this part of the
Yeah.
world, because a lot of people would actually not present heart hospitals. Uh, and of course, they seek alternative forms of treatment. I'm sure which one of them would be um, herbal medications.
Hmm.
So there is no evidence to support any herbal medication um, um, as being curative for pulmonary tuberculosis. And I usually give a warning when it comes to herbal medication, because you don't know exactly what you're taking, you don't know the quantity of what you're taking, and some of these things have deleterious effects on the liver, on the kidneys. So they can actually make the condition a lot worse. And like I said, the treatment is completely free. You will not pay a naira for the medications. So it's important that people understand, because I'm sure about concussion too, sometimes they may have to source it. This is completely free. Treatment is completely free. So present at a nearby health center. So there are some health centers that have facilities to screen, diagnose, and treat tuberculosis. So people should present at hospitals where they can be diagnosed and started on effective treatment um, and followed up properly for tuberculosis. Thank you.
Thank you very much. We have two questions, sir. Let's take one here. Okay, good. Please, what is pulmonary tuberculosis?
Okay, so pulmonary tuberculosis is when tuberculosis affects the lungs. That is what we call pulmonary tuberculosis, when it affects the lungs. Yeah.
We have another one. Doctor, can TB generated from parents to their children? Okay, can it be passed from parents to children? Oh, okay.
Okay, so um, I would suppose these parents and children live under the same roof. So if you have, like I said, the mode of transmission is via inhalation. So when the person expels or coughs out or white talking, in whatever form, expel these organisms in their household, and the children inhale it, they can develop tuberculosis. Or transmission from mother to an unborn child um, um, have not been documented in literature. So there's no evidence to support that. It's via inhalation. So, but
I
if a
think his
woman,
question is like inherit. If the generation can inherit
okay,
TB.
no, it's not something. It's something you acquire. So inherit is
Exactly.
something we use the word inherit. It's something you are born with. So depending on the genetic makeup of the parents, you get half of your genes from each of the parents. So that's what you are you are born with. Tuberculosis is an infection that you acquire, not inherit. So it cannot be inherited. Thank you.
Thank you very much. Do we have any other comments? I hope I'm not missing anyone. Sir, briefly, I don't know if you would want to talk about the relationship between tuberculosis and HIV.
Okay. Um. So tuberculosis and HIV are like brothers and sisters. Yeah. Okay, so HIV infection or development of acquired immunodeficiency syndrome is actually one of the most significant risk factor for development of tuberculosis. So, for example, let's say that someone has been exposed to TB before but has not developed the disease. So the person acquires HIV infection and becomes established and all that, and it lowers the person's ability to keep the infection in check. The person actually has close to 100-fold compared to somebody who does not have HIV of developing tuberculosis. So it's now standard of care to screen all patients who have HIV or tuberculosis. So if you screen and they have the disease, you treat. If you screen and they have the infection, meaning they have come in contact with the organism before and they acquired an infection but not the disease, you need to put them on TB preventive therapy. I think I mentioned this when I was talking about that. So HIV category of people are actually people that you want to treat before the disease occurs. So you suspect they have the infection, or you make an assessment, you diagnose that they have the infection. You need to put them on medications, prevent them from developing the disease. And this can vary from 6 to 9 months for treatment. But rather than use the 4 drugs that we talked about for treatment, you used just a single medication in this category of people. Treatment in them is also not so straightforward. I'm not sure, I don't know if I should go into that because of the technicalities involved. Because when you are taking more than one drug at a time, there can be a reaction between these 2 medications such that one can make the other ineffective. And this occurs in people who take anti-TB drugs with HIV drugs. So there's a lot of technicality behind that. It's a bit challenging managing people who have HIV and TB. But it's very important to note that I think TB uh, or tuberculosis is actually one of the highest. It ranks high among the causes of death in patients who have HIV.
We are almost out of time. Sir, please, we have a comment here. It says, please, can you compare or, I don't know, differentiate between latent and active TB? Wow, we're having questions here.
Okay, so um, latent TB is when the person acquires an infection but does not have the disease. So this subset of people, there are certain things that you can actually do to confirm the infection. This includes things like a skin test, a blood test, which can actually show if the person has had TB infection. Okay, and if this is positive, without the person having those features that we talked about. So somebody who has latent TB will not have cough, will not have weight loss, will not have drenching night sweats. So they will not have the symptoms and signs of TB. And when you do an X-ray for them, they will have a normal chest on the X-ray, meaning that there is no affectation of the lungs. But you are able to demonstrate that they have TB infection. So latent TB is just another word for TB infection. And the significance of that is that what it simply means is that the body's immune system is able to keep it in check. These people have a risk. Okay, so about 5% or more of people who have latent infection can go ahead and develop active TB when the conditions become favorable for the bacteria. Okay, so if the person uses certain medications that depresses the immune system, the person develops cancer, this can also um, depress the immune system. The person develops diabetes mellitus, it depresses the immune system, and yeah, and the person can develop um, active disease. So we are saying disease is when um, the person has those clinical features that we talked about: weight loss, cough, drenching eye sweats, fever, have abnormality on their X-ray, and you're able to confirm by doing a sputum test. So, collect their phlegm, you're able to identify or isolate the organism that is active TB. Thank you.
Okay, sir. There's still another question here, which says, can the lungs come back to normal after being treated for TB? And can someone get TB repeatedly?
Okay, so in a fraction of people, yes, the lungs can come back to normal after TB infection. Because in some people, there are telltale signs. Like I said, sometimes you have scar tissue formation. Sometimes you have what we refer to as what looks like small, round shaped patterns on the person's lung when you do an X-ray. So, but in some people, it can come back to normal completely. It can. And then, so can someone get it repeatedly? Yes, it is possible. So there is what we refer to as reactivated TB. So the person has TB, and like I said, it spreads throughout the body. And sometimes the organism, because the organism is actually a special organism because it's able to lie dormant in the body for a very long time, for years. It's just there, lurking in the dark, it's hiding. When the conditions become favorable, the person can develop what we call a reactivated TB. And then because we live in an endemic area, that means TB occurs regularly. Um, Someone who has had TB before can actually be reinfected. Okay, so not even the one that is dormant in the body now becomes active again. The person can reacquire the infection and have what we call TB reinfection. And I also like to state that having had TB before, haven't had TB disease before, having been healed from TB before is actually a risk factor from being healed from TB again because of those two factors. So if the organism is just lying there and it becomes active again because the condition becomes favorable, the person gets reinfected because the person is susceptible to the infection, then you can have it repeatedly. But we actually find a lot of cases where people are treated for TB on more than one occasion. Like when I was talking about complications that can actually develop from TB the other time, there are so many things that can occur after successful TB treatment. You have killed the organism, but the person is presenting with some diseases that look like TB but are not TB. Because they present in a similar way, the person will continue to cough out sputum, sometimes cough out blood, they might lose weight, they might get tired easily. All those things we talked about. But that is not tuberculosis infection. So that's why it is important, okay, not just for even the public now, even for doctors who manage tuberculosis outside of the teaching hospital setting, to understand that because the person has had TB before and they are presenting with features that are similar to that of TB does not mean they have TB again, especially when you do the sputum test and it's negative. You have to think about something else, or you refer to a tertiary center where the person can be properly evaluated and treated accordingly. Thank you.
Thank you, sir. So the questions here have been taken before. Just Bright, your questions on bone has been addressed. I guess you are just coming. So Dr. Ogundare already spoke about TB affecting the bone. He spoke about TB and HIV. So you want to watch this video, please try to watch it again from the beginning because we are out of time. Sir, do you have any word as we round up tonight that to ice the cake, what we call icing on the cake, that we need to know tonight?
Okay, I think we've said almost everything. The most important thing is that people should understand that it is preventable and it is curable in most cases. So having tuberculosis is not a death sentence. What is important is early presentation. So once you have cough lasting more than 2 weeks, you notice you are losing weight, notice you are sweating excessively at night, your clothing, your bedding is soaked, you have fever. Even if you don't have all of this, once your cough lasts more than 2 weeks, please see a doctor. It's important to diagnose it early and treat it to reduce most of these complications that we talk about. And this also helps you to protect your loved ones. So the earlier you present to the hospital and you're started on treatment, the lower their likelihood of acquiring the infection from you and they also developing the disease later. And that people should stop the stigma around TB. And then, yes, it is possible to end TB, which is part of one of the United Nations strategy of ending tuberculosis by the year 2030. Thank you all very much for listening.
Thank you so much, sir, for joining us. We are really grateful to have you in our midst. Thank you so much. I believe all our listeners have gained something from the teachings. And as we said, yes, we can end TB, which became the theme for this year World TB Day. That yes, we can end TB, which took place on Friday, that is on the 24th of March. We've said our presenter have said a lot of things today. And one thing I want us to know that the treatment is free. I know most of us, because of financial reasons, we don't want to go to the hospital and all.
Oh, what happened? Network. Okay, let me take it up from there. I also know that a lot of people like to self-medicate, and the place of herbal concussion, agbo, and tuberculosis, it doesn't work. Please, this idea of trying to stay at home, manage yourself before you go to the hospital can be very detrimental. Dr. Ogundare spoke about the symptoms, how to make the diagnosis, and even prevention. And I believe with all this, we can prevent and end tuberculosis. We are very grateful, sir. Thank you very, very much for joining us tonight. We don't take this presence here for granted at all. Thank you so much.
Thank you very much for having me.
Thank you once again. And ladies and gentlemen, thank you for joining us. You just listened to Dr. Ogundare Adewale. He's a senior registrar from the Department of, is it the Respiratory Unit? Yes, of Lagos University Teaching Hospital. Like we always say on this program, yes, I gain a lot. Thank you very much. Yes, thank you so much for your questions. They helped us massively, and I was happy you were able to engage with our guests tonight. This program is every Sundays, 8 p.m. to 9 p.m. We try to work with time. We don't want to go beyond 1 hour. Thank you, everybody. We'll be here again next week, Sunday. Maybe next week, Sunday, we'll be having a question and answer session. Yes, that will be the first Sunday for the month of April. I believe so. Yep, yep. So thank you, everybody. Take care of yourself and have a wonderful night. Remember, good life. Good life in a sense. Bye bye. Au revoir. Good night, good night, good night.